have always had a research strategy. We've always built that into the way in which the hospice works, and it's expected that we will be doing research here.
I think Pilgrims has been successful on a number of levels. The people we have working here I think is key. A number of really important people who've motivated, who've driven, who've provided the background, the knowledge. It's been phenomenal, and to have such an excellent team on board has been great. But I think it's important also to identify the trustees have been key in this. So the trustees have been key to support research. They've seen the value of it. They've been prepared to put a bit of resource forward so we can have our own research facilitator. And I think as busy clinicians we're keen to do this stuff, but without the support of Charlotte, our research facilitator, of Rose, our research nurse, we would never find the time to do all these sort of things.
Some examples of some topics where we've involved service users and members of the public are around our hospice at home research that we've done, and also in developing a project around COPD care. In addition to advising on research, in the project recently I've been involved in, we've been almost adopting a more equal partnership in developing some of the tools for the project, so information sheets, data collection processes, and they're also helping us to interpret some of the findings as well.
I think the challenge is finding the right studies that actually will infuse somebody within the hospice, get on and do the work. Sometimes the studies aren't really suited for the hospices, so I think that's a very important area. Secondly, funding. We're very fortunate that we have some funding from the NIHR through research nurse and also from hospice, and I think that's very important. Not all hospices may be able to fund this work. And one thing that seems terribly important is the role of the trustees, that they see research as being a very core part of what the hospice is about.
End-of-life care, palliative care is a challenging area because we have some of our patient group, of course, are very unwell, and that presents its own challenges. And some people might say that perhaps it wouldn't be ethical, but I feel that actually there's a counter-argument that could be made to say, well, everybody who receives healthcare should have an opportunity to know about research and have them make their own choices as to whether they'd like to participate.
So the future for hospice research I see as being rosy. We're getting increasing numbers of chairs and research units that are working in palliative care specifically, and I can see it only growing. We're starting to get some really decent national studies underway. We're starting to challenge some of the really important topics and trying to get questions for them. So I'm very hopeful. If we get the right funding in place, the right research streams can come through to help us do that, I'm sure we can achieve that. Pilgrims particularly, we have a new medical school starting up in Canterbury, the Kent Medical School. I see that as a great catalyst to improve our research even further. And what we're starting to see now is the studies we've been taking part in are starting to be published. And it's just lovely to see those articles in print, to send them round to staff, to send them round to the trustees and say, look, this is all the work that you've done. We started just to get a little bit of financial recompense from it as well, so maybe then staff can go to some of the bigger conferences, can present the work they've done, they can see the wider world of research. And I can only hope there will be a more and more active research unit as the years go on.